Food and health.
Causes and risk factors. What causes diabetes? When you receive food, your body transforms the food you eat into glucose, a form of sugar. A hormone called insulin allows this glucose to enter on the cells of your body and be used as energy. Insulin is produced by the pancreas. In someone who has type 2 diabetes, the pancreas doesn't make enough insulin, or the body's cells can't use insulin properly, called insulin resistance. This causes glucose to build up in your blood instead of moving into the cells. Too much glucose in the blood can lead to serious health problems that may damage the blood vessels, nerves, heart, eyes, and kidney. Am I at risk? What can I do to reduce my risk? Talk to your doctor about your risk factor for diabetes. Although you may not be able to change all of them, you can make changes to significantly lower your risk. What are the risk factors for type 2 diabetes? Weight. Obesity is the single most important risk factor for type 2 diabetes. The more overweight you are, the more resistant your body is to insulin. To figure out if you are overweight, check the charts and talk to your doctor. A healthy, low-fat diet and regular exercise can help you lose weight gradually and keep it up. Weight and risk. Find your height in the left column, then look to the right to find the corresponding weight. If you weigh the amount shown or more, you may be at risk for diabetes. Age. The risk for type 2 diabetes increases with age, especially after 45 years of age. Although you can't change your race, you can work on other risk factors to reduce your risk. Family history. Although you can change your family history, it's important for you and your doctor to know if diabetes runs in your family. Your risk for diabetes is higher if your mother, father, or sibling has diabetes. Tell your doctor if anyone in your family has diabetes. Race, ethnic background. For reasons still unclear to doctors, some ethnic groups have a higher risk of diabetes than others. You are at greater risk if you belong to one of these groups: Native American, Hispanic Americans, African Americans, Pacific Islander. Exercise. Exercising and maintaining a healthy weight can reduce your risk of diabetes. Any amount of activity is better than one, but try to exercise for 30 to 60 minutes more days of the week. If you haven't exercised in a while or you have health problems, talk with your doctor before starting an exercise program. Diet. A diet high in fats, calories, and cholesterol increases your risk of diabetes. In addition, a poor diet can lead to obesity, another risk factor for diabetes, and other health problems. A healthy diet is high in fiber and low in fats, cholesterol, salt, and sugar. Also, remember to watch your portion size. How much you eat is just as important as what you eat. Gestational diabetes. Gestational diabetes is a kind of diabetes that happens early during pregnancy. It occurs in about 4% of pregnant women. Although gestational diabetes goes away after pregnancy, 40% to 60% of women who have gestational diabetes are diagnosed with type 2 diabetes within 15 years. Even if they don't have gestational diabetes, women who give birth to babies who weigh 9 pounds or more are more likely to develop type 2 diabetes later in life. Polycystic ovary syndrome. Polycystic ovary syndrome (PCOS) is a condition that occurs when an imbalance of hormone levels in a woman's body causes cysts to form of the ovary. Women who have PCOS are at an increased risk of developing type 2 diabetes. Multiple risk factors. The risk of developing type 2 diabetes increases with the number of risk factors you have. If you have 2 or more risk factors, talk to your doctor about how to delay or prevent type 2 diabetes.